everyone, I'm Natalie Kunsman, MD, and I thought I would address who actually uses functional medicine and why. Well, the first tenet and principles of functional medicine is it tries to get to the root cause, and it's very aggressive in its preventive strategies, as well as adding those tools to help thy body heal thyself. So I would say that this approach is fantastic for young kids as they are learning the ropes about diet, nutrition, wellness, movement, sleep patterns, cutting down computer time, and communing with other people. So this will probably resonate with the average family unit so that you can teach children to keep their bodies well. Now, of course, the adults that come to me many times have had conditions, or what I describe as the cat is now out of the bag. They have chronic health conditions, they have immunologically based compromised conditions such as autoimmunity. They have toxicities that they need to get rid of. They may have obesity by this point, or diabetes, or hypertension, or those core health conditions that, if not addressed at some point, will lead to catastrophes such as death or infirmity and disability. So many times, adult like that scenario will have received traditional medicine. And again, I do not want to discredit traditional medicine, because the tenets and principles of working a patient up, the differential diagnosis, coming up with a game plan based upon the problem is its forte. The treatment arm of traditional medicine winds up being medications or surgeries or aggressive arrows in the quiver. But this is where functional medicine comes in, because those tools may be necessary, but also some of the underpinnings of the functional approach, such as nutrition and movement and supplementation and energy work and work on mental health and sleep and purpose for living and spirituality, all affect and all are needed to help with the aggressive approach. Now, of course, there are well patients that also in their adult phase of life want to remain well or optimize performance. There are people who don't necessarily feel ill, but they don't feel well. Their hormones may be on the decline. They may be approaching their 50s and have a little extra weight, or a poor time sleeping, or a very stressful home or work life. And the tenets and principles of functional medicine will go after those root causes. I often think of the patient in functional medicine as protoplasm, chemistry, and energy. All three of those big factors are addressed with the functional approach to maybe even sometimes eliminate medications, cut down medications, go after the side effect of medications, potentially prevent a surgery, and of course, to promote your wellness and your well span until your expiration date. So I've often told people that my job is to keep you well until that expiration date. And there are so many tools in the tool basket to diagnose. Go after your SNPs and genetic underpinnings. Go after your metabolomics and how you metabolize. Go after your food insensitivities and intolerances. Go after your gut health and your gut microbiome. Assess whether or not you have toxicity in your profile, such as the heavy metals or toxins or infections, or now we even have to concern ourselves with long COVID, mast cell destabilization because of COVID, or the new mRNA vaccine strategy that now has some people on their third and fourth booster. These are not natural compounds to our body, and some people are having difficulty with them, not only processing their normal cellular energy, but also it rendering their immune system compromised or changed for the new infections and the routine illnesses that are in the environment. So we've identified children, we've identified adults that need to optimize their health, and of course this could also be performance as far as an athlete is concerned. We have identified the person with chronic health conditions that are quite severe and need more of a complementary integrative approach to round out that healing and wellness. And then of course we have the advanced elderly, in which they need to feel comfortable in their aging body. And there are so many strategies to help with cellular repair, mitochondrial function, improved movement, and of course, improved mentation, memory, vision, and enjoyment with communing with your people and your spirituality. We just scratched the surface with functional medicine, but I have identified nearly every walk of life, every gender, every age bracket, every persuasion, every ethnicity that has benefited and actually is looking for the functional medicine approach. That said, you can find me at nataliekunsmanmd.com, and we can dive in and meet you where you are in your health journey.